Hello, my name is Sarah Strabinger, and I'm a program analyst with ThinkWell. Today I'll be talking about how governments can leverage financing mechanisms to improve private sector reproductive health care. Let's start with explaining a bit about private sector health services. The private sector is a large and diverse range of non-state individuals and companies who span a spectrum of roles in health. Speaking specifically to private providers, some examples include faith-based organizations, pharmacies, or traditional healers. The private sector is already a major source of care in low and middle income countries, and the sector is only growing. Governments are motivated to leverage the capacity of the private sector to ensure affordable and universal access to quality services. And one way for the government to do this is through financing mechanisms. While there's no one-size-fits-all approach, governments can leverage financing mechanisms to remove financial barriers, expand access by adding new service delivery points, and improve the quality of reproductive health care. Here are some examples. Governments can first use financing mechanisms to remove financial barriers to private reproductive health care. Now, the private sector is already a major source of care, but service delivery is often limited to those who can pay for it. By contracting private providers, governments can remove regressive out-of-pocket payments for reproductive health services and expand accessibility to care. Next, governments can use financing mechanisms to attract the private sector to deliver services by creating a strong value proposition. The private sector must perceive the value of engagement to outweigh the costs of engagement. For instance, governments can offer competitive rates for reproductive care delivered by private providers and subsidies for inputs. This allows private providers to see provision of care as a profitable business proposition, while also allowing clients to access services who would not be able to afford so otherwise. Finally, governments can use financing mechanisms to improve the quality of private sector care. First, governments can define the minimum quality standards for private providers to contract into a scheme. If the value proposition for contracting is strong, private providers will work to maintain the minimum quality standards, and quality will consequently improve. Further, governments can choose to use a payment mechanism that's linked to performance. Using this mechanism, payment can be modified by the quantity and the quality of care provided. Thank you so much for listening, and remember to follow ThinkWell on social media for other health financing related content.